Adult spine deformity is a significant abnormal curvature of the spine in adults, including significant loss of the normal curvature of the spine. Said another way, the spine curves in the wrong direction where it should not curve, or it does not curve in places where it should curve. Here's an example of a normal spine. It is straight from the AP view or front view and has a normal curvature from the lateral view or side view. This is normal lumbar lordosis, thoracic kyphosis, and cervical lordosis. Scoliosis is an example of abnormal curvature where the spine should be straight. On the left is a patient with a spine that curves from left to right when it should be straight. This is a well-balanced curve in that this patient has shoulders that are still square over her hips and her shoulders are nearly level. Alternatively, you can have an unbalanced curve with tilted shoulders or an offset, as you can see here. We measure scoliosis curves using Cobb Angles to see how much of a curve there is in each of the curves. Here you can see there are 3 curves, and we measure the curves at the levels of the vertebra with the steepest slope to measure the maximum curve. We can also use these measurements to monitor progression of a curve as long as we're careful to measure the same levels each time. Some curves will progress and some will not. The curves that progress may do so slowly at about a degree per year, or quickly at a few or more degrees per year. Scoliosis can occur for a variety of reasons. It can be congenital from a birth defect, though that's not very common. It can be idiopathic, occurring in the early teens and without a clearly known cause. It can also be degenerative in adulthood as the discs collapse asymmetrically. Kyphosis refers to abnormal curvature or abnormal straightening of the spine from the lateral view. Here, this patient has severe kyphosis of the thoracic spine and is hunched over. Kyphosis can also be the result of spine fractures or can happen after a spine surgery with collapse above a fusion. Here's an example of a patient referred to us after multiple previous surgeries and an attempt at cementing to prevent fracturing that unfortunately did not work and led to this sharp kyphosis. In general, spine deformity should be evaluated carefully and regularly monitored. Sometimes surgery may be appropriate, but this requires a complete evaluation and careful planning. It should never be considered lightly, and it is always worth getting multiple opinions.